All right. Hi everybody, this is Dr. Lin. We have Gabriel here. He is a patient of ours. He's been on our spinal decompression DRX 9000 for a period of time, and he's feeling better. And we're gonna share with you guys. Okay, you can look at me. You can look anywhere you want. Okay. All right. So, tell me, what is your symptom before you come in?
My symptoms before I came in were lots of pain in my leg area.
Which leg do you mind?
My left leg and my thigh area. A lot of numbness. I couldn't stand probably for more than a minute without my leg going numb. And had a lot of pain in my lower middle back, more in the left side of the regional area.
Okay.
And also in my toes.
Your toes.
Right.
And your toes is numb or pain?
My toes actually are. I don't have as much numbness anymore.
Okay. Okay. Now, how long have you had the problem?
I've had the problem for probably a good 20 years.
So for 20 years you've been suffering pain like this?
It gradually worsened throughout time.
Okay. What was the beginning like?
The beginning wasn't as painful. The beginning was tolerable. I didn't think much of it other than just spasms in my back or tight muscles. And then it wasn't up until about maybe 4 years ago when I had a CT scan done that my doctor told me I had 4 protruding discs.
Okay. Well, why are you taking the CT? Is it because pain is getting
worse?
Worse?
Because he wanted to see if there was any obstruction in like maybe the kidneys or the bowel area, but there was none of those. There was no obstruction anywhere, and it was determined that after the CT scan they did the millimeter of degree of protrusion, and that's when I knew. At that time, 4 years ago, it wasn't as bad. It was, probably at the beginning stages. But within the last 4 years, it's just really got worse.
It's getting worse and worse.
Right.
Okay, so you were saying that you can't hardly walk.
I couldn't. Mostly it was standing.
Standing. Okay.
Right.
Walking.
As long as I kept walking and moving, I could get blood going.
Okay.
So
walking.
But once I stopped and stood still,
yeah,
I couldn't. I had to sit down. I would get a lot of numbness. My whole leg would just go completely numb.
Oh, I see. How about you sitting then? At that time,
I would have to sit down.
And when you sit, you feel better.
Right.
It just went away.
It would go away. It would subside.
Subside.
Right.
Okay. And
laying down it was even better.
Oh, okay. Laying down is better. Okay. That's same for a lot of patients actually.
Right.
Okay. All right. So have you seen any doctor for this past 4 years, or for any treatments at all?
My doctor only recommended neurologist.
Okay.
And that neurologist only recommended nerve pain pills.
Okay. And did you take them?
I took them, but I didn't see no difference.
Improvement.
Right. It wasn't so much the pain; it was just the numbness was really bothering me.
Okay. And did you go any other place? Any
no, I didn't.
Physician? Okay. No. And you found us.
I found you on my insurance website.
Right.
I put in. I looked up all the in-network doctors, chiropractic doctors.
Yeah.
3 came up, and you were the most feasible, the most to get to, and actually was closer to my living area.
Oh,
and so I did hear about the treatment through the radio. And then that's when I started searching out a chiropractor.
Right.
And I called, and I inquired, do you do this type of treatment, spinal decompression treatment? And your reception said yes. And she and I said, okay, can I get an appointment to get evaluated and get consultation on it?
Okay.
Right.
What do you think of our service with the consultation and the front and everything else?
I thought everyone was pleasant and made me feel comfortable.
Okay, great.
And I haven't had a problem with this office.
Okay, that's great. And can you tell us how you feel now? Can you, what can you do what can you not do before and now you can do? Can you tell us?
Well, I definitely have less numbness. I don't have shooting pains in my thigh like I used to.
Mm-hmm.
That was a constant before I started the treatment. That was a constant thing, is shooting nerve pains.
Mm-hmm.
I can stand longer.
How much longer can you
I would say probably a good 5-10 minutes.
5-10 minutes longer? Yeah. Okay.
Yeah, depending on, of course, how I'm standing,
Mm-hmm.
and not slouching or,
Mm-hmm.
but standing, as erect as,
Right.
and being careful of what I do.
Right.
I don't have as much pain driving anymore,
Mm-hmm.
and I don't have. I noticed I had a clicking sound in my back before, and I haven't heard that in the last probably week or two.
That's wonderful.
Right.
Okay. How about
That's helped out.
How about your numbness? Just tell us about your numbness now.
The numbness still comes, but after a longer period of time.
After a longer period of time.
Right.
Okay.
I notice I can stand longer.
Right.
And without it going numb within a minute.
Okay. Okay.
Right.
So you can drive better now.
I can drive better
you can
now.
Stand longer.
Stand longer.
And what other aspect of life have you noticed improving?
I think just being more comfortable.
Okay.
And being able to tolerate, really not tolerate anything, because I haven't noticed
Right.
that much discomfort as I did before.
Mm-hmm.
Before I was really in a lot of discomfort every single day.
Right.
It was there to remind me.
Right. Oh, that's great. And how many treatments have you had so far?
I believe this is now 6th or 7th.
I think so. Yeah, I think 6 or 7.
Right.
Okay, so you're getting along. You're doing very well. And by 20th, I think the numbness should be gone entirely.
Right. And that's what I'm hoping for.
Yeah. Okay, great. Thank you, Gabriel.